Hello, this is David Scott Lynn, and one of the questions I get asked a lot is how is I'm able to get muscles to release and relax and let go when other forms of therapies have failed, or they work, but the problem keeps coming back over and over again. Well, that's a good question. I'll give you an example of what I'm talking about. I had a client, she lives up in Sedona, and I worked with her for, I don't know, about a year and a half or so. But the first 30 sessions or so, there was a quarter size, let me turn my notifications off there. There was a quarter size knot right in the base of her neck, on her left side of her neck. And this thing had been bothering her, I feel it was 20 or 30 years, something like that, much of her adult life. And it was something that was chronic, was there all the time. She seldom could sleep through the night, had to have a brace to sleep on, and often was in debilitating pain for days at a time. She had access to some excellent healthcare practitioners, including the former acupuncturist for the president of China back in the old days. And so I started working with her, and this knot was so hard, it literally felt like a bone. And bones can get pretty hard. So what I did was my basic technique. My basic technique is surprisingly simple. And when I apply pressure to a muscle, first of all, I don't start very deep. I start on the light side. And I hold steady pressure on the muscle with very little or no movement. No cross fiber, no up and down gliding, no stroking, no twanging, just slow, steady pressure on the muscle, sometimes for long periods of time. I would frequently, the first 30 sessions or so with this woman I was telling you about, we did about an hour. The sessions were 2 hours long, most of them, but we would do at least an hour just on that quarter-size spot in the base of her neck. And I would just literally be like this the whole hour. Now, I did sink in some as the muscle relaxed, but it was extremely incremental. One of the principles that I use, my layman's terminology is you can't it's easier to open the door before you walk through it, and you can't peel an onion from the inside out. So what I mean by that is that when we start with applying pressure, I go to, again, a very relatively light pressure, enough so that they can feel it, but the second principle is no pain, more gain, meaning nothing that I'm doing should cause pain or discomfort in the client. I should not be increasing their pain level. So they should like or be neutral about what I'm doing. They should be inviting the sensation, not fighting the sensation, and it's not about what they can tolerate. If they're tolerating anything, I am too deep. Their main job through the process of the session is to keep me informed as to whether the pressure is too deep, not deep enough, or just right. The just right basically is what we call the edge of pain, fear, and resistance, and that's the amount of ideal pressure. So when we're on the edge, we are just right. Now when somebody goes, edge, that means we're over the edge. Okay, so anyway, so the idea then is you go to that first layer of tension, and if they will focus on their breathing, get a little more meditative, it works better, but it's not necessary. People get results, and then their mind drifts, whatever. They read, they listen to things. I don't really have a rule about that. All I know is that, in my experience, it does work better if you can stay more meditatively focused through the process. But even if you don't, it still works. So you go to that first layer of pressure, hold that steady pressure. If they'll breathe, it'll help. But then what'll happen is if you just hang out, you will eventually experience a layer of relaxation in that muscle. Now it might be an extremely thin layer. I mean, it might feel like almost nothing. But what you're doing as a therapist is you're learning to become more sensitive to the very subtle changes. Now, what you really need ahead of time is to have a certain mindset. That mindset is that we aren't treating the muscle. We aren't trying to make the muscle relax by relaxing the muscle directly. What we're doing is we're applying pressure to the skin and the muscle cells and the fascia in such a way that we're sending sensory signals up to the central nervous system and brain. In the central nervous system and the brain, if they are experiencing a positive experience, or definitely not a negative experience, even if it's neutral, it's probably okay. But as long as they're not feeling like there's some instability, some attack, no need to defend, not worried about pain, if the client trusts that you aren't going to hurt them, or that you will back off the instant the client says back off, then what happens is they trust more and they can relax more. And what happens is the synapses in the central nervous system and the brain, which are the chemical switches, they're physical, but they have a chemical bath. There's a chemistry at the synapse, and that chemical bath has been modified over the years such that the synapse gets stuck in the on position. What we're doing by applying pressure and triggering the proper nerve impulses to the central nervous system and brain, what we're doing there is triggering the ability of the central nervous system and the brain to change the firing at the synapse. So the synapse, the chemical bath at the synapse starts to change such that the nerve is no longer stuck in the on position, because as long as the nerves are stuck in the on position, then the muscle will be stuck in the on position. And since so many organs are made of muscle, most of them, if not all of them, smooth muscle rather than skeletal muscle, they will be stuck in the on position as well. So the organs can be hyperactive, like the intestines and the stomach and so forth. So what we're doing then is we're just waiting for the nervous system and brain to make the change in the muscle rather than me jamming around and trying to make the muscle relax. So we're relying on a psycho-neuro-musculo-fascial sensory motor feedback loop. I know that was a mouthful, but that's what it was. But anyway, it's signals going, putting pressure on the muscle in such a way that you stimulate the nerve endings at the ends of the muscle, and those nerve endings send a nerve signal first into the spinal cord, and then it's processed there, and that's where the initial relaxation of the muscle starts. However, there's also activity going on in the central nervous system and brain in the upper regions that also are probably hyperfacilitated. In other words, if the person's problem keeps coming back or is so intense it won't let go, then there is probably participation in what's called the reticular activating system, which is a layer on the top of the lower part of the brain. You might be familiar with the three brain theory. And the first lowest brain, which is sometimes called the reptilian brain, that's where the unconscious or non-conscious control of all the muscles in the body runs. It's also called the tonus system, and it maintains the tonus in the muscles. And so if your synapses and neurons are aggravated and irritated and facilitated, which is a word for increased, if the activity at the synapse is increased, then the nerve will be increased and the muscle will be increased. And if it's increased enough, it won't turn off. And so you got chronic tension. So steady pressure, whatever muscle it is, obviously if you're working here, it's going to not be a lot of depth there. So here you'd be doing more of a stretch this way rather than a press in. So in the thicker muscles, you can press in And the thinner muscles, it's more of a dragging action. So like if you've got wrinkles here, like I got some wrinkles there, okay, by taking and the muscle fibers are going the opposite direction from the wrinkles. So the muscle fibers are going this way. So if you come in here and go horizontally this way and put a little traction into the muscle fiber, which gives it an actual little kind of a mini stretch, and you just hang out, and that's where you go for getting the relaxation. Now, the next step, though, or the next point or aspect is time. Some of these take a lot of time. Some of them don't. For example, I had a guy who was scheduled for his second hip replacement in the same hip. The first replacement had been done by Johns Hopkins. They cut off the top of his femur, the thigh bone, took that knob off, put the metal appliance in and installed it and patched him up and sent him home. Well, they were scheduled for a second surgery because that metal appliance, the head of his femur, the head of the thigh bone, was breaking through the wall of his pelvis. Now, if you don't think that was bone on bone, that was not bone on bone, it was metal on bone, but you can be pretty sure that the first surgery was because, before they replaced the metal, was because of bone on bone. So what did I do? I looked around to see if the pain was coming from other places. It did not seem such. So what I did is I just worked in that hip, and I worked, and the muscles in that hip were so tight it was, felt almost like bones. They were really, it was like knocking on soft wood, if there is such a thing as soft wood. But I did 3 90-minute treatments on him in the course of a week, like every other day. And he got 100% elimination of pain, complete restoration of movement, range of motion. And he was a carpenter carrying his own drywall, plywood, tools, and so forth. And a year later, he was still out of pain without further treatment. However, I did show him a few stretches to do to maintain it. Whether he did the stretches, I don't know. He lived in Alaska, so it was a little hard to keep up with him. But I met him in Tennessee where he was doing some work for his father, who was a good friend of mine. So that was only 3 90-minute treatments to undo the need for a hip replacement. And that's pretty good. My cousin, who was one of the most highly trained orthopedic surgeons in the country, said, that was pretty good. He said if he had to get a tune-up every few months or something like that, he would definitely opt for the therapy rather than the surgery, even though he was a surgeon. So anyway, it's slow, and what we're doing is we're treating that muscle like the onion, and that each layer of the onion is like a doorway to the next layer. So you're waiting for each door to open, each layer to relax, and what happens is the muscle takes you deeper into it. You don't have to press harder so much as you just keep enough pressure to take up the slack. And then what happens is the muscles just start to respond, and each thin layer by thin layer starts to relax. Now, I did like 30-some treatments, I think, on that neck, the quarter size thing in her scalene here, before she was really well improved. And so that's something that to think about is the amount of time it might take. So if you're working on yourself, or you have a partner, husband or a wife or a family member or a friend who could just apply pressure on the muscle for keep that steady pressure and not go too deep. Hey there, how you doing?
Good, how are you?
Good, thanks. You're back?
Yeah.
Cool.
I know you're still here.
I'm leaving in a few minutes.
Oh, really? For
Yep.
good?